Good.
When I had my frozen shoulder, I felt like T-Rex. I was angry because I couldn't move my arms up above my shoulder. And there were actually very many reasons to be angry about having frozen shoulder. First of all, I didn't know what caused my frozen shoulder. And second of all, I didn't know what tests I needed to get. And third of all, I didn't know which specialist to go to. And then I didn't know what different procedures they could use to treat me. It was very confusing. And last of all, most frustrating, I didn't know any techniques I could use to heal myself. So, and I also found that women with frozen shoulders were angry because they couldn't get their hand up above their waist to unbutton their bra strap, and I certainly couldn't and even brush my teeth or comb my hair. It was very aggravating. It made me feel like T-Rex made me feel angry, like I wanted to eat somebody and roar. But actually, I'm not T-Rex. I'm Dr. Larry Burke. I'm a holistic musculoskeletal radiologist. Holistic musculoskeletal radiologist. And back, long before I had my frozen shoulder, I was one of the early pioneering researchers in MRI of the shoulder. And that was back when I had impingement syndrome on my left shoulder, which had rotator cuff tendonitis and bursitis and a lot of pain, and for which I eventually had arthroscopic surgery. And since then I've read thousands of MRI scans, some of whom have frozen shoulder, adhesive capsulitis. Other patients had many other illnesses like rotator cuff tears. It's quite easy to tell a frozen shoulder from a rotator cuff tear in an MRI scan. Along the way, I've worked with a lot of different orthopedic surgeons to understand the diseases of the shoulder and different treatments for them. As a radiologist, one of my main frustrations during MRI was dealing with patients who were claustrophobic, so I learned hypnosis as an alternative to IV drug sedation to get people in and out of the scanner successfully. That was my intro to the whole field of alternative medicine. And then after that, in 1998, I learned acupuncture and was co-founder of Duke Integrative Medicine. There I was the education director charged with educating all the medical students and the lay public about all the different nuances of different alternative therapies, such as acupuncture and hypnosis and chiropractic and massage and a variety of other modalities. I also practiced acupuncture and hypnosis in the clinics at Duke, and eventually, in 2002, was introduced to a new mind-body approach that was a great combination of both acupuncture and hypnosis. At that time, I encountered my first patient who had frozen shoulder, and using this new approach, was able to heal their help them heal their frozen shoulder within a matter of weeks after they'd been frozen for months, and they were very pleased with the result. Shortly after that, I left academics and went into private practice to do teleradiology from home, where I no longer needed to wear a tie, and also become a mind-body coach online, working with clients all over the world with Zoom or Skype. By this time, I had fully recovered in my left shoulder and had no more pain due to all the different alternative therapies I'd learned to use. But then a couple years later, in 2006, I developed a right frozen shoulder and was very angry about the experience of being restricted in my motion like that. But I went on for a few weeks, but fortunately I was using all the self-healing approaches I know about. I was able to heal myself in a matter of a few weeks instead of having it go on for months and years like it does in many cases. Now, I've also been able to regain a lot of my upper body strength, and I'm now actually working out for my master's pole vaulting comeback, because I haven't been this strong since I was a pole vaulter in college, and I'm now working out a couple times a week doing 3 sets of 30 push-ups to regain my strength. And I'll just demonstrate a few of those just so you believe it is possible to really heal your shoulder like this. I'm doing regular push-ups. And even military push-ups, even harder. And the most hard push-ups that I do are the hands closed push-ups. You go way down and way back up. And those are really challenging. Now, if you want to learn more about rapid healing for frozen shoulder, I'm going to do an online course coming up relatively soon. And if you want more information about that, the first 4 classes are free. And check out my website, LarryBurkeMD.com. That's LarryBurkMD.com. In the meantime, I hope you start to heal quickly.